And back to our coverage of the COVID-19 pandemic, numerous studies have emerged so far on COVID-19 across different disciplines. These studies include discussions on public perception of COVID-19 management, e-learning, palliatives, precautionary behaviors, among others. Now, these gaps motivated collaboration between Ekiti State Government and the African Leadership Center at King's College London to embark on research that would primarily assess public perceptions of government leadership response to COVID-19 in Ekiti State. Now, I have joining me Research Associate, Africa Leadership Center, King's College London, Dr. Damilola Adegoke. He joins me virtually. Good to have you join us.
Thank you very much.
So,
this will be it.
I read a bit of your study, and I sort of found it interesting because one of the things that this study sought to figure out is the fact that a lot of people do place or did earlier on place a lot of significance and importance in how the federal government handled COVID-19. But you wanted to focus so much on the state because you felt like the state also had a role to play in terms of how we handled COVID-19. I know that Ekiti State was used as some sort of case study for other states. Talk to us about what you found in terms of the response by states.
Thank you very much. Like you mentioned earlier, the study was carried out in Ekiti State, and what really necessitated that was because we felt that most of the attention, most researches and studies, even by policymakers and even the focus of the media, they've always been on central government and regional government. So we saw the gap there, and that was why we used Ekiti State as an exemplar. And some of the findings that we discovered, though it would be too early to extrapolate to other states, but it's quite interesting to note that we note there is this focus more on political actors rather than people who are on the ground, and we saw a little bit of exclusion of, though not deliberate. And I must say that this is not only it's not about Ekiti State now, but we noticed that the attention people, most of the policy interventions have always been involved those who are political actors and those who are on the upper middle class cadre, or to the exception of those who are local residents and people who are really based in that particular in the state itself. So, and I believe that except apart from the federal government, Lagos State being a kind of capital state and a kind of a state that is very attuned with that is digital, that attuned with that's commercially viable and very popular. Most of those people who have really sought to really intervene and to really interact, they've not necessarily taken into cognizance the relevance of youths, of those who are local actors, like traditional rulers, like local academics, even in their intervention procedure. So
and that for me was sorry, I had to quickly jump in because I don't want to lose the point you're making. And that for me was one of the most interesting parts of this study, the fact that the study did say or state that a lot of people also used social media to measure the perception of COVID-19, and that for this study wasn't reliable. Some people took what the media, also took their perception from the media without actually checking, the not so literate population, which is also the voting population. And what did you find? What does that section of the population think about COVID-19, especially when you look at the fact that there is so much misinformation about COVID-19?
Thank you very much. Of course, the usual attention is to focus on mega influencers, those who have voices on the internet, and in most cases, these people are not really on the ground. But what we did was to go and try to take cross section of the societies who don't really have digital presence. So what we found out was that most of what their expectations, they were more focused on palliatives. They would really want government to really interact with them and get them involved. And then we noticed that most of what really generated some kind of concerns, which also nosedive into some kind of pocket of protest, not in the States anyway, but in parts of the country, was because because of lack of transparency the perceived lack of transparency in COVID-19 distribution. Some people alleged that most of the people who really they were politically exposed persons, and then they were not really carried along, and And like I said, even now, you would notice that even of recent, most of the people that are really active participants, even in interventions and measures, they've not really been people who are really, really active on the ground. We also made recommendation also that micro influencers, these are local influencers, not necessarily that they don't really have, they might not necessarily have social media presence, but they really have influence on the ground. These are people that should be accommodated when trying to plan any sort of crisis communication intervention in the future. So the people who are really, those excluded, their voices have always been that why they welcome the update, the confirmation, and the need for lockdown. When people want to lock down and they are really not economically viable, and how would they sustain themselves? So these are the things that
Dr. Adegoke, I'm sorry, because I found that report very interesting. I have just very little time left. I just want to quickly touch on this. What lessons do you think we can take away from this study? I found it really interesting. But what lessons can state governments especially take away from this study in terms of how we handle the COVID-19 pandemic?
Yes, I would want to say that part of the one big key lessons that we want to, is the need for a kind of distributed communication systems where we would not only focus on the kind of hierarchy where those who are not, the attention should not be more on those who are politically exposed or those who are in the upper middle class. All across different cross-sections of society should be carried along, and then the messaging should be clear. And I must say that while in the case of the Ekiti and some other states, because Ekiti really had a very active crisis communication system outside of Lagos State, because Lagos also had a very active system. Other states also that we measured, we take a little bit of glimpse from them, can also develop a kind of robust active system, but not only a kind of unidirectional model that we have presently in the states mentioned. There should be a kind of multidimensional interactions between those who are actually affected by, who are actually impacted by this COVID-19 and the government. There should be a kind of interactions between them. That mechanisms will be dealt with by the respective states, really.
Really, the messaging has to trickle down. That's where we have the bulk of the misinformation. Thank you so much for talking to us. Research Associate, Africa Leadership Center, King's College London, Dr. Damilola Adegoke.
Thank you.